to be alongside our panelists today who will share their stories in CYBHI's multi-payer fee schedule consent collection. Before we get started, simply to name, TadHealth is not providing legal guidance through this webinar. We encourage all local educational agencies, LEAs, and community-based organizations, CBOs, to consult with their own legal counsel regarding consent-related requirements and decisions. Our goal today is to hold space for conversation and share the experiences and stories of partners who have engaged in this work. We're grateful for the guidance of state, DHCS leaders, and thought leaders who have been working hard to address the needs of LEAs and CBOs around parent consent for CYBHI's multi-payer fee schedule. Today, we're joined by Sarah D. Duncan, Wellness Center Coordinator and Mental Health Grants Project Director from Eureka City Schools, and Frank, Director of Student Services from Santa Monica-Malibu Unified School District. Thank you both for being here and for sharing your stories with many that are currently or seeking to implement CYBHI's multi-payer fee schedule. We'll jump in. Maybe we'll start with, how would you describe parent consent and the role it holds in reimbursements or revenue to support the great services offered within your districts? And maybe we'll start with Sarah D.
Yes, thank you. Thanks for having me. Okay, the role. So in mental health world, we know that we always require consent for services. This is kind of, I think, new for schools who are used to just often providing services. The role that the consent plays in this a new world with CYBHI is that it's required for billing of insurance. It also acts as an ROI, a release of information, ability to share information, and it's a consent for services and billing. Generally is what CYBHI wants you to have. So it's an important part because it will allow you to do it. Also important because it involves the families in this brand new program that we're all trying to figure out together. So it's an opportunity to have those conversations and also access the valuable dollars for your district to provide services.
Beautiful, thank you. I hear required for billing, for insurance, also can be an ROI, maybe intertwined into that one form.
It's like not a full ROI, but a ROI for sharing of information pertaining to like your mental health or pertaining to your insurance, things like that.
For billing. Yeah, beautiful. And the opportunity to involve families, which is crucial. And Frank, how would you describe what is consent to you and your district, and what's the role it holds in
Hi, everyone.
reimbursements?
Thank you for inviting me. I'm so pleased and happy to be here and help folks take advantage of this opportunity. And to me, is a lot of what Sarah D mentioned. It's a compliance step, right? It's what we need to be able to access this opportunity. But I've made it a personal goal for consent not to be a compliance step. I think consent is what builds trust with families. And I usually call it informed consent. I want people to understand exactly what this is about. And it's the first step to make anything successful. You want to earn the trust of your community, of your parents. After that, everything seems to fall into place and become a lot easier. I think it's essential for participation in services and the willingness to allow billing. But when families understand and feel comfortable with the process, I see that districts see stronger engagement, and this is my experience, and more consistent, sustainable sources of revenue. So I think it's both. It's the compliant aspect of what we need, but also an opportunity to connect with family and explain this opportunity.
Oh my gosh. You said so much in that you referred to it as informed consent, Frank, and while it is a compliance component, there's a compliance measure to it.
Right.
Really integrating that into your school, your community, your culture as a whole there that supports trust building. Yeah, crucial. Um, and how did you mention preparing? Maybe we'll start with Frank this time. How did you prepare for consent collection for billing and reimbursements?
Uh, let's see, we built consent directly into our existing annual data confirmation. But when I was preparing for this, my thinking was, how can I make it be part of an existing process instead of adding another layer, another consent, another avenue for parents to have to go to and in another email. It's like, what is it that we do? And I got together with our IT team. And I mean, I've discussed this with every department in the district, like, how can we embed this process? And it was really IT through Aries. I said, well, we have this avenue and we can incorporate it in that system. So automatic, I didn't have to create anything else. And this is a process where every year families already review and update their information for those who are familiar with Aries. So again, we embedded consent services for billing and for wellness services, both consents in there. And again, I focused on making the language clear and transparent, which is huge for me and for my community to understand that we're not taking advantage. We're not going to do anything
Yeah.
weird with your insurance. And more importantly, that nothing's going to happen. There's no impact to their insurance or their premiums. So that was a huge part of it. And again, I think I'm just happy that it allowed us to create a consistent method, sustainable to capture what we need to capture engagement, right? To engage our families and to inform them of what's going on.
Mm, beautiful. You said consistent and sustainable, crucial pieces that seem to be quite effective for you and within your community. That's great. Thank you. And Sarah D, how did you how
Yeah,
did you go about preparing? Mhm.
we had many iterations of preparation. So, well, before we had CYBHI, we had our wellness centers and they were new to us. So for about 4 years, we've been working towards what we finally have now, which I think is much better than what we started with. We had started with opt-out letters. We For services for parents. We then moved to opt-out letters in our welcome back packets, which were not digital still 3 years ago. um, and we found through that process that, lots of things. People don't read things is one of them. So we would get letters back, but then when the kid might need services, we would still call the family and say, hey, we know you opted out, but we want to offer this. And they're like, oh, I didn't even know what that was about or what you were talking about. I'd love for my kid to have services. And then we also, I think this is a question later, but like we hadn't prepared how we were going to store that paper document that we got back. How are we going to track who's opted out, who's opted in, who consented, who didn't? So that was a part that we had to think about. Where are we going to hold? Who's going to hold the consent information? Where are we going to find it? How are we going to track who can have services and who can't? And through that process, we also received a technical assistance grant for CYBHI. So we worked with someone hand in hand who kind of was able to walk us through the process, also give us examples. And so through that, we worked towards what we have now, which is what we call a passive consent, but it is an informed consent. It's finally electronic. Yay. Welcome to the 21st century. So this last school year, it went out in our welcome back packet electronically. I don't know how my tech people got it, but I think you couldn't even pass it. I don't think you could skip it. I think you had to fill it out. And in that consent, we also collected the insurance information on that same form. And that has been invaluable, honestly. So I kind of wanted to show you the iterations of how this went through that. And yes, I think having it electronic, having the information embedded also in, so we had CYBHI information embedded in that consent so people could be like, what is this about? We also have, because we've been working towards this rollout goal for a couple years, we've been prepping staff, prepping families, sending out information about CYBHI so it wasn't news to them. So I think that I think it just takes people a long time, me included. We need to hear it in multiple ways and see it in multiple ways to kind of get it together. And then we're like, oh yeah, I know what that is. And I know what this is about. So I think just keep peppering that information out to your families so that they know when you say the thing, what you're talking about.
Yeah, sounds like a through line within both of your experiences that communication was crucial to communities, to families, potentially to staff as well. And what do they say? 13 times, right? We as humans need to hear something 13 times to truly sort of it lands to then be able to think critically through impacts for oneself. And so I hear maybe similar strategies related to different methods of communication. I think, and Sarah D, you mentioned 4 years and the iterations from the leadership and that includes the management of it all to the very technical details that had to be discovered and sitting in the ambiguity of it all while developing the process. Yeah. Frank, how long did it take you to establish this system that you have in place?
Uh, 2 years, really, to
Mm-hmm.
understand, and like Sarah D mentioned, to understand, um, for me to start with staff, right, to get buy-in and to address anxieties and concerns around this program. So like the first year was really staff and leadership, and then the second year has been parents, and it's been strategic. It's been through PTA, and it's been emails and communications and presentations. But I think that aspect doesn't end. I think every year you get new parents every year, and so you have to add. It has to be part of your communication every year. It's either you do a town hall or you address the new parents. So every year you're still, trying to get the buy-in and build a relationship and get new consents. So yeah, 2 years.
Yeah. Oh,
Yeah,
beautiful. Oh, go ahead, Sarah T.
I was gonna say, yeah, I was thinking about like we still at all open houses and everywhere, you're still tabling, you're out there with your CYBH information. We're out there with our paper forms. Like, can we still
Sure.
get your insurance in here? We're out there with our tablets. Can you fill out this and can we still get your insurance like all year long? You're kind of trying to get it any way you can.
Yeah. Yeah. It's not something that goes on maybe a sticky note or on a list and you check it off and it's done. It's something that is crucial to be reoccurring and informative for all members, acknowledging that there are new members of communities that enter and are welcomed into the space, and perhaps this is a part of the welcoming into communities. Yeah, that's great. Thank you for sharing. And maybe, recognizing that both communities or every community has its own, certainly their own needs, and local context is crucial in developing one's own system to consent, building. Maybe when consent first became a priority in your district, were you starting? Where were you starting from? Excuse me. And what did building a strong consent process actually look like in practice? Or were you starting from zero? Or was it a bit of a foundation, acknowledging that the field of mental health has existed for decades and the Children Youth Behavioral Health Initiative multi-payer fee schedule is new? The opportunity to draw down sustainable dollars to be reimbursed for services that are already occurring or maybe are being built in that consent building process for the multi-payer fee schedule. Did you start from zero or was there a foundation built? Where did you start?
I
Oh,
can.
sorry, we'll start. Yeah, go, Frank.
Okay. Uh, yes and no. So I did some clinical work in the past. So I was very familiar with the consent process, with the all process. But that was my focus, right? My focus, I was a clinician, so it was part of my job to be collecting information and making the copies. And so I came with that experience. And in schools, this looks a lot different. Collecting the consent. I didn't want this to become the whole spirit of the fee schedule and me partnering with TadHealth is because it facilitates the process. It doesn't make my counselors and our team clinicians. and doing the mechanics and the paperwork. And so that's when this whole thing started is I want to align with the spirit of the fee schedule, and I want this to be as easy as possible for everybody who wants to participate in the billing. So with that in mind, like how do I, again, it goes back to why I even automated the consent, right? So I don't want anybody to have to be chasing consents and like Sarah D, where do we store it? And now this is a HIPAA document or FERPA document, like and HIPAA potentially too. So all those little things, when I came in to Santa Monica, I was thinking, okay, how do we make things easier, automated? How do we get things off our counselors' plates?
Yeah, and I just
Highlighting there what you named, but this is different. Yeah. Yeah. Go ahead, Sarah D.
Yeah, and I had a similar experience. Like I come from a clinical world into the schools. And so I was also a one-woman show my first year. So I was really figuring it out, how to work in the schools. And so I came with my understanding of what I know I do as a clinician, which I know I get informed consent, I know I do all these paperworks, right? And then I think I already discussed sort of the iterations of like sending out a letter like, hey, we have a wellness center now, and we do this stuff here now. And then the next year was like the opt-out form. And the next year was like not an opt-out form. It was almost like a just here's what's going on form. And one of the things I think is important going into the schools and thinking about like what our counselors or what our staff are already doing in schools is thinking about these are like, we don't generally get consent for like a tier 1 service. Like if your kid is crying, we're going to talk to them. We're gonna comfort them. We're gonna say what's going on. We're not gonna go, I'm gonna need your consent and your insurance, and I need you to fill out all these documents and a medical history so that I can talk to you about why you're crying this morning, right? And so I think thinking about framing it that like we're gonna be doing this tier 1 supports, and your parents are probably not gonna be upset about that. They're going to hope that you talk to their crying child. And then the layer that the CYBHI all payer fee schedule brings is now we can maybe collect on that. So we're going to collect on something that we're already doing. And I think that was really important for staff to understand, like you're not changing your work. You're going to maybe change how you document it maybe one more time than usual, hopefully only one more time than usual. But you're really providing these services that in some ways don't need consent because they're not in a clinical context. And I think we're going to talk about that a little bit later, the difference between sort of like passive and active consent. And I really mark things up for my staff as like, are you having an informal conversation or are you having a formal conversation? Like those are times you need to go, are you playing basketball and building relationship on the court? Could it be billable? Sure. Is it a formal relationship that might require like the second layer of consent? Probably not. So really just thinking about the services that you're providing that the school may have already provided that we don't really need consent for. And sort of when that line might be where you might want that more clinical informed consent, as we call it. So to answer your actual question, it again 5 years of I'm just doing this one thing by myself to now I have a team and we have this billing system, and so it has become a more formalized process. But I really think understanding that tier 1 area where we do a lot of our work is something that I think parents expect us to do anyway, and want us to do for their children anyway. And so they're not really going to be upset about that and want us to do that and maybe want the school to get reimbursed for that.
Yeah. Yeah. As a mom, oh my gosh, please help my child if they're crying. My heart, like the tears, I feel them. I feel it. Yeah. And I think just to clarify what I hear the team referring to is consent to bill and the release of information specifically for with related to the consent to bill. And Sarah D, you distinguish the difference between almost a higher level of care within schools that typically requires consent. And then Frank, you also referred to the difference. You said we're not clinicians. Well, as many clinicians, right, in the room, also acknowledging that the experiences in a higher level of care in the field of mental health that are oftentimes associated with other billing mechanisms, there's a lot of compliance paperwork that's involved in it, and it is a higher level of care, and I'll have room for in this in the ecosystem of communities as a whole, of course, and here really focusing on the CYBHI multi-payer fee schedule and consent processes. Anything else to add to that? That was great, great. Thank you both for sharing. It's certainly been a journey for you both, and I don't know, Frank, if you were going to add to it there.
Yeah, I wanted to really focus on what Sarah D mentioned of the different types of consent. We have social workers as well in our schools. And so we've just recently trained them that even if we obtain consent through ARIES, through the data confirmation, it does not mean that once you enter a therapeutic relationship, right, more like moderate to severe, that's a different story. Now you need a therapeutic consent, informed consent for those services. So just make sure, right, for folks who are here, that we have different levels of need, so therefore different levels of consent. Okay.
That's a good distinction. Talk about the process. How did you go about building that, and training or supporting all members of communities to know the difference? I hear communications, and with your background, Frank and Sarah D, you both referred to consent and higher level of care, typically in the field of mental health as a whole. Mm-hmm. How did you go back training your staff in that manner, Frank? What did that look like for you?
So all of my social workers, most of them come from the clinical setting. And so they understand informed consent and everything that takes all the legal and the ethical issues around mental health in California. So they came with training about what this process looks like. I just wanted to make sure that they understood the difference, that this is not going to replace their requirement to obtain informed consent for a therapeutic relationship. But it also alleviated some of the concerns from the counselors, the non-licensed staff. Like, okay, so let's discuss mental health in tiers. So we're using the MTSS framework to break up this level of services within mental health. What's tier one? What does that look like? So for us, obviously, it's prevention, 2 and 3. And so in training, it's like, well, once you start looking at 2 and 3, perhaps we need a different type of consent. If you're licensed and you're a social worker and you can provide that type of service.
Breaking it up within the tiers within LEAs, right? Tier 1, 2, and 3, and training staff around that model that's already existed, and now really integrating CYBHI multi-payer fee schedule into the MTSS framework. Yeah. Sarah D, anything to add?
I appreciated the MTSS model that I didn't know until I came to the schools, but building our own our mental health services tier was crucial. And that's something I trained people, like, these are your tiers and you need to do this tier and someone else does this tier, because I have wellness coaches as well. And so really having that framework is crucial. And the consent is almost built into that itself. All right. So tier 1 probably doesn't need informed consent. Whereas as soon as you go to tier 2 or tier 3, you are in what I call a formal relationship. You have now entered a formal relationship, and you need informed consent. So a group or any ongoing one-on-one engagement, even for my wellness coaches who do brief intervention, that's 3 to 4 meetings. I think when I was starting this out, I also talked to my school counselors, the school psychs, like, how do you deal with this? And they all sort of gave me this, like, the rule of 3, that if I'm talking to this kid more than 3 times in a scheduled manner or in a way where we're talking about a symptom or a problem solving, I have probably entered into a formal relationship, right? I'm not just having lunch with them talking about their boyfriend or, talking about their favorite, video game. We're talking about something that has been formalized, and I probably need informed consent. So I took that from the people who were already doing services and sort of built off of that. We have like a permission for services, which is our basic, like, can your kid come to a group? And then if they're entering into a formal therapeutic relationship, then we have an informed consent. That is more of the traditional clinical consent. But I think just training around, like, also we always talk about, if I'm pulling your kid from class, from school, then you should probably know that. If they're coming to a lunchtime group, or it's during a classroom presentation, then I probably don't need to inform you. But if I'm now pulling your kid from math every day or once a week, I'm going to probably need to let the parent know that that's happening. So those are sort of some of the ways I train people on, teaching them of, like, when you've entered a formal relationship and when you're still in an informal relationship, and what kind of consent you might need for those scenarios.
Mhm. Thank you. Thank you. That's great. And this is all really relative to consent to deliver services or
Yes.
treat, depending on the level of care. And then I hear this is being connected to the consent to bill processes, and that you both have built. Frank, you integrating it into the data confirmation system, Aries, and then Sarah D integrating it into the first aid packet. And then you both spoke to some of the continual parent engagements that or communications that you both uh, engage in to support in gathering consent to bill from families. And can you speak a bit more to that? What does that communication look like? Sarah D, you spoke to, maybe we'll start with you, spoke to attending, having a table, excuse me, at all the events, and more. So what does that all look like? What does that communication look like to build trust?
Yeah, we're just trying everything right now. We have a website, so we have our CYBHI information up on the website, the brochure. Everything's on there, so we can direct people there. We send it out. We use Parent Square, so we'll send out periodic posts about that on Parent Square, and then yes, and tabling, and just trying to continue to keep that conversation going until it's just normal, until people don't even know anymore. They're just like, oh yeah, that's part of school now. So
Normalize it, yeah, really embedding it into the school system.
yeah.
Yeah.
And speaking to them, like, they know, like, a lot of it, besides like therapy, most of this stuff has been going on in their schools anyway. So, a lot of it's not like new. And so I think having that messaging of, like, now we're just helping the school get reimbursed for it and being able to continue the services. It was already happening. Now we're just going to benefit in a way that will help the staff, school, continue these programs. And that's a pretty easy sell for most of the time.
Thank you. Frank, can you share your experiences and communications to families and building trust within your community?
Same. I reeled back some of the communication because I don't want parents to get desensitized to it and, like, another text message or another email, and people start reading it. And so we're doing a lot. We have a podcast, and so we use the podcast. We still use the text messages, but not as often, because I don't want parents just to block it off. And then when it's time to provide consent, they're like, "What is this?" Because it happens with everything else. We're using the superintendent's YouTube channel, and for next school year, we're scheduling every school a PTA meeting. So I'm going to meet with their PTA, who are usually the leaders of the community, and spread out the information and address parent concerns from the parent perspective. So it's usually more successful than me going to parents and explain. So when it comes from one of their peers, one of the community members, it seems to be way more successful than me pushing a lot of info to them.
Ah, beautiful. I heard podcasts, which I'm a fan of, and I don't know if we have time, but you've got a lot of great work there as well. And you both mentioned the website, email communications. Frank, you mentioned not wanting to almost over communicate's not it, but have families feel desensitized to some of the text messages or emails that were going out, and sending messages through superintendent's YouTube channel. Yeah. Great, great. And messaging going out, of course, from trusted community members. And we might have maybe 2 minutes here. Frank, can you speak a bit more to the podcast?
So it's a partnership we have. It's through the Boys and Girls Club, and they're hosted at one of our school sites, and it's actually run by our PTA. And we discuss, it's at one of our middle schools, but we discuss everything, education, parent concerns, and it's got a good audience. And so, yeah, I've rolled out whenever there's, policy that will be rolled out. I go to their podcast, and I know people are tuning in.
I
So
better
it's not technically ours, but it's one of our school sites, and I mean, all the conversations are around obviously school and student services.
I'm gonna have to subscribe, but it sounds like a great partnership between a community-based organization, the Boys and Girls Club, as well as parent-driven and community-driven, right? So for community by community, um, uh, being that PTA certainly leads it as well, and in partnership with you and your team. So great, great. Thanks for sharing about that. And we thank you both so much. With that, I'm gonna hand it over to Victoria for some questions. And yeah.
Awesome. Thank you so much, everyone. So we have a good amount of questions that trickled in. Thank you, everyone, for asking them. Throughout these answers being distributed, please feel free to continue asking, and we'll try to get to as many as possible. But if not, we'll be sure to circle back afterwards. I'm going to drop an email in our chat that you all can reach out for more information to. So feel free after this webinar to reach out, and we'll triage you to the correct professional to answer that. So the first one that we had come through is, are you including CYBHI language in your student policy manuals? And would you be open to sharing that language? For the second part, we do have a CYBHI parent guide being sent out after this webinar, and that will have some example language, but I'll go ahead and let the panelists answer whether they are actively sharing that language in those guides and their process behind it.
Maybe go for it, Frank.
Okay, so the question is, are we considering policy around CYBHI? Not necessarily, or at least not yet. I think most of what we're doing is practice. I think maybe a regulation, an administrative regulation for staff members to understand how do we do this work, and how do we protect privacy. In terms of policy, we do have a student wellness policy. Perhaps that could be a good avenue to mention CYBHI. But for now, I think it's a good question. I'm gonna consider it. I think I'm more interested in the AR, so that people, it just establishes the workflow, and this is how we do it, and you keep consistent across the school sites. But good question. Not as of right now. And in terms of sharing the language that I've used for consent, absolutely. Yeah, I can show that.
And Frank, AR, admin reg? You want to?
Administrative regulation, yes.
Thank you.
And I do think we included it in our student handbook because we were trying to get our wellness centers and our mental health services just being, again, normalizing it, like, this is part of school. This happens. And we've always had at least one sentence that says we may attempt to recoup costs, but I think that's all it says right now. So adding something about CYBHI was probably a good idea.
Awesome. Thank you for your answers. More are still trickling in, so thank you so much. The next one we have says, we are working on our registration packets for next year. If we already have insurance information and informed consent, do we need to get all of that information again next year, or can we request updated information if anything has changed and offer opt-out instead of having to get all of the information and consent again?
Most consents are required to be annual.
Yeah.
So even if nothing changes, you still have to get annual consent as best practice.
Yeah. And for your claims to be successful, the information has to be updated year to year. And this is why I go back to find a way to automate the system so you're not having to collect consent for however many families you have in your district.
Perfect. We do have another question. This question reads, how are you handling families who are cautious about using insurance or any state funding due to immigration cases? And in parentheses, it said, immigration lawyers are recommending to families for their families not to use any government or state funded programs right now.
Okay. You want to go, Sarah? I'll go after you.
Yeah, I was gonna say, well, the good news is we get to provide services whether you have insurance or not. And so that is not a barrier for care. We also, I think my billing specialist will attempt to reach out to parents because we can help connect them, but if they don't want to get connected, they don't have to. And that's okay.
Yeah, same here. Practice is not going to change. We're not providing anything, like Sarah D was saying, that hasn't been provided ever. But I do in the data confirmation an opt out. And so if parents have a concern, and I did it intentionally so that we can connect with families. I want to understand where the concern is coming from. So their opt out is it generates an email to me, and I reach out to the family to, again, make that connection, make sure that this is an informed decision, not just sort of, I'm concerned or why is the school doing this? And as of right now, I've had about 5 families opt out, and I have 2 that I still need to connect with to, provide some more information. So out of almost 9,000 students, I've only had 5 families opt out.
What an accomplishment from you both, and thank you both for sharing these, very, very real experiences.
Awesome. This one, you mentioned, Frank, that you had 5 parents opt out. This next one specifically asks about percentages. So we actually had 2 come through asking what percentage of each district population provided consent.
I would say almost 99%. Like I said, 9,000 students, close to 9,000 students. I only have 5 families who opt out. And 6, one of them said, okay, I'll consent after you heard the information. And I still got 2 families to connect with. So it could be even less.
And I haven't checked recently. I think on our first round, we had like 87% return rate on our first try, which was pretty good. Alex could probably answer that more specifically, but I've had the same experience, and something I like to share is like most families, if you talk to them, are like they just don't understand, and they're fine with it and they want to consent. And so when you do reach out, they're going to be like, "Oh yeah, that's great. Here's my information and everything." Most of the time.
Perfect. Thank you all for being so great. I know we're throwing a lot of questions at you, but they keep coming in, so it's awesome that you all are here as a resource. Another question came through and it asks, is there a different process to obtain consent for students over 13 years old?
Best practice for the school, we practice that even though minors can consent for services, that we will want them to consent through parents for insurance purposes. We'll use family health and safety code as needed on a specific basis, but we always try to involve parents or have there be some consent and informed consent in those cases. So it's very rare. So we're not doing a different process.
Same here. And I promise that Sarah D and I did not connect before this. I'm glad to hear that we're consistent.
Yes.
So same thing. We deal with it case by case. We try not to use the family code as much.
Thank you both for sharing your experiences. Yeah.
Awesome. So we did get a question come through and it says, can you talk more about your billing specialist and what they do?
Yes, and I can't recommend hiring a billing specialist enough. When we got our billing, when we finally hired our billing specialist, it like really the wheels just started rolling. We had all the information, but as we all know in schools, we're all wearing like 16 hats, and the billing is a whole different world. It's a different language. It's something people study and know. So find just somebody who can understand and speak to those people in their language. And our billing specialist coordinates all of this background stuff I'm talking about, coordinates the collection, reviews it, sees where we're not having our consent. They coordinate with TadHealth. They coordinate with the people who actually are doing the billing. Ours also does our bot billing and ESMA, all the other stuff. So she is on top of all of that, and thank the Lord, all the gods for her. So would recommend that job for your district.
Don't have
Awesome.
one. Not yet. That's the goal. It's definitely, and for you to be able to align SMA and LEA Bob and the fee schedule and have one person do it consistently, that's the goal. So hopefully with the revenue from this program, we can hire that position.
Yeah.
It pays for itself.
Yeah, I was gonna say I think we use our bot money to pay for her, and it is worth it.
Yeah.
Awesome. So the next question is, are you gathering insurance information at the same time you ask parents to opt out? If so, is that at the same rate or is it harder to get?
Let's see if I understand this question. So through the Aries portal, for those who have it, every single year, right before the beginning of the school year, they get an email reminding them to get onto the parent portal and update all the information. At that point, every year, that's when parents will have you go through their demographics, they go through consents about sports and injuries, and all the waivers. And then you get to my section, and I provided some snapshots to TadHealth, and they're more than welcome to share it with you all, or like what that looks like in Aries. That was very successful for us this year. I mean, our first year, and like I said, we only got 5 families opt out. So I recommend do it at that entry point. I was discussing it with some folks from Downey Unified School District also. They have a different SIS, but they have the same capacity. So now they're looking into how do we make it happen as well at the point of enrollment or at the point of data confirmation.
And our consent has spaces for the insurance information on the same form. And I can't remember, that was the one. I think you could click through it. You had to sign it, but you didn't have to provide your insurance information. So now we are, for those missing pieces, we are doing direct outreach for any of the missing insurance. We also have a box that says I don't have insurance, which then flags that we can maybe help them get if that's an issue or something they need to help them out with that.
Yeah, same here. And in that same portal will have I made it optional because when parents are signing in, they might not have it available to put their insurance. Yeah. And that's okay as long as I get the consent, because then TadHealth will let me know if that family is not insured, and then we can outreach and obtain it at that point. So we have it there for those who can access it and put it in there, but we know that most of them we're probably gonna have to follow up to get them in.
Awesome. So we did get more questions that trickled through the Q&A. Unfortunately, we do have to wrap up Q&A just for time's sake, but I'm going to drop an email that folks can reach out to for more information after this webinar. And just feel free to reach out. It's my work email, and I'll be sure to point you in the right direction based on your question and get you your answer as soon as possible. We just really appreciate you all joining us today. Consent plays an important role in helping districts build a strong and sustainable approach to CYBHI's multi-payer fee schedule, supporting the work already happening to support students. Thank you to our district partners for sharing their experiences, and to Marcella for guiding today's discussion. Following this webinar, we will be sending an email with a recording of today's session, in addition to our latest CYBHI multi-payer fee schedule parent consent guide. I'm going to share the screen to show the cover of the guide so you all know what to look out for. Do you all see this? Yes, perfect. So this will be sent to you by members of our team. So keep an eye out for that. And like mentioned previously, those include examples from partner districts on consent language and all of the tips and tricks that they shared today for your CYBHI multi-payer fee schedule success. Um, Again, if you have any questions or would like support as you continue your CYBHI multi-payer fee schedule efforts, the TadHealth team is here to help. So please email us at the email I dropped in the chat, victoria@tadhealth.com. Sarah D. and Frank, do you all have any closing remarks?
I guess be kind to yourselves during this process, and it's changing as it is also changing from the state. Some of your folks, I was just in a discussion with the state that they're considering having interns be part of the fee schedule so they can bill. So this is it's not gonna be fixed and then anytime soon. It's gonna keep on changing. And so be mindful of the updates, be on the lookout for CYBHI updates, their policies and their laws also changes. So again, just be flexible and be willing to change according to the needs of your district and according to your legal team also. Just because I was able to do it doesn't mean that you might have to go a different route in your school district. But as long as you get creative, and I'm here to consult. You can always email me, and I'm more than willing to help you all out access this opportunity because at the end of the day, it's just more supports and services for our kids.
And I would just like to say, like, don't be scared. I think people are scared, and you don't have to. We're all in this together. We're all learning, as Frank just said. Like, things are changing all the time. They're adapting, but there's an amazing team of people, including TadHealth and the state, that we're all doing it. We're making mistakes together. We're fixing them together. So don't be afraid. You got to try. Go for it. Get some funds for your kids and your families.
Love that. May we make different mistakes, right, as time goes on, and how long, and continue to sit in the ambiguity as it comes, knowing that great work is happening. And may we build with joy, as the start of the sessions started with that song, and knowing that you have a community alongside you, ready to partner. And may we draw down those dollars to reinvest in our communities, developing systems of care that will outlive us. Victoria?
Definitely. Thank you all for just everything you do to support student mental well-being, and we look forward to seeing you all next time. Bye.